Hello everybody, my name is Thomas Doty. I'm a paramedic here with Orange County EMS. So today we're going to be talking about is intramuscular injections. For our BLS and even our ALS providers, one common thing that we're going to use for our intramuscular injections is epinephrine for allergic reactions. One thing to keep in mind with IM injections for epinephrine is we are not going through the close with these syringes. These syringes and needles are not intended to actually go through the close in comparison to what you may see with our auto injectors. One other thing is our preferred site for epinephrine is actually going to be the thigh rather than the deltoids. Make sure also our solution should not exceed 2 cc in adults in the thighs and 1 cc in pediatrics in our thighs. And again, 1 cc in the deltoids as well. So after we've talked about that, we're going to break out our equipment and see what we have here. So as you see, we have a 1 cc syringe with a needle already attached. We have our alcohol prep pad or chlorhexidine and our solution. So we're going to uncap our solution. Make sure to remember that the color identifier is not unique to epinephrine or any other medication. A lot of times they do change, so don't rely simply on the color and actually look at your label to see what medication you have. We're going to confirm that we have epinephrine at 1 milligram and 1 cc. And we're going to come over here at our expiration date and ensure that the medication is not expired. Here within Orange County, we use MAC-check, Medication Administration Cross-check. Okay, so we're going to use another provider, the patient or bystander, and we're going to say we have epinephrine at 1 milligram and 1 cc. There's no contraindications. Our indications are going to be allergic reaction or anaphylaxis, and our medication is still in date, and no contraindications. So after that, we're going to take our syringe, we're going to uncap our needle. What I like to do is I like to draw up about 50 to 75% of what I'm going to draw up in my solution of air, and I'm going to insert it here into the vial. After I've inserted in the vial, I'm going to inject my air into the vial. And what that's going to do is that's going to aid in drawing up the medication. So I'm going to retract my needle just to the bottom of the vial, and as you see, is when I release the plunger, it's going to automatically just start drawing it up. And that's because of the air that we've put into the solution. So I'm going to assist that in drawing up 1 cc of that solution. See, I have 1 cc here. So that 1 cc is going to be 1 cc and 1 milligram. That's our concentration. Each rung here, 0.1, 0.2, all the way up to 1.0, is actually going to be 0.1 milligram up to 1 milligram of that epinephrine. So we're not going to recap our needle. We're going to take our needle and we're going to dispose of this in a sharps container. We're going to apply our new needle here, and now we're ready to inject it. Again, we're injecting this into the thigh for anaphylaxis. If the patient is conscious, alert, and can understand what you're saying, we're going to explain to the patient what we're doing and why we're doing it. So we're going to find our site here. Now we're going to inject the medication. So first and foremost, we're going to open up our alcohol prep pad and we're going to clean this site. Ensure that you're cleaning this in a circular technique for about 15 to 30 seconds. After you've done that, you want to spread apart the skin to hold the skin taut. Come in at a 90-degree angle and insert this needle in. You're going to aspirate the syringe by pulling back the plunger and ensuring that you don't have any blood return. If you have blood coming back into the syringe, that's indicating that you're actually in a vein, and if you do, you're going to take out your needle and find a new site. So after we've done that, we're going to inject our medication. So again, we're injecting 0.5 cc's or 0.5 milligrams. After the medication is in, we're going to retract. We're going to rub in that medication here, dispose of our needle and syringe accordingly in a sharps container. We're going to apply a Band-Aid and reevaluate our patient. We're going to spread our site across to make sure it's taut and flat. Come in at a 90-degree angle and inject the needle. After you've injected it, we want to aspirate the syringe by simply pulling back the plunger. Ensure that there is no blood return into the syringe. If there is, immediately pull this out and find a new site. After we've done that, we're going to inject 0.3 to 0.5 cc's And I've injected 4.5 milligrams. And then we're going to take this out. And I like to rub the medication in. And then we're going to take our syringe and place our needle into the sharps container and apply a Band-Aid here. And that is intramuscular injections. Thank you.